think, a common sense explanation of food insecurity. It's not having enough food to make it through each month. Root causes may be things from a chronic illness, from a change in lifestyle, to a loss of job or a divorce, or a lot of family situational things.
For a lot of families, that will look like a week where you don't have enough food to get through the weekend. We have so many families who are also struggling to pay rent, who may not have health insurance, who have so many expenses that they're trying to juggle.
That food insecurity affects people differently across time. One thing is just how common food insecurity is, and we do see that, but we don't see it if we don't ask.
Food and access to food is a really important component of everyone's health. I mean, I think the face of food insecurity looks like all of us, and any of us. You don't know if someone's struggling with food insecurity just by looking at them.
So a few years ago, we began to screen all of our patients and families coming into the hospital for food insecurity, thinking that we needed to know that information because we understood that it correlated with health. We've evolved our program to know that families respond best to a written question. People have a lot of shame around food insecurity, and so they worry about judgment. We know some of our families have identified they fear that their children will be taken away from them if they identify that they struggle to feed them, and they don't necessarily automatically trust us. So a big part of this has been to build trust and build those relationships, and that we have to learn to ask them in the way in which they will answer most candidly.
We do that in a few different ways. One in just a paper form, so families are able to do that sort of when they're alone, filling out their paperwork, and it's an opportunity to check in about that. It also gives us an opportunity to share with families why we do it and that we do it for everyone.
When we have a positive food insecurity, we do tend to work with the parent directly to connect with our social work team.
Once we have those conversations, we have the resources to offer to families. So we're not just saying, oh, that must be really hard, but instead we're able to say, okay, let's talk about these different resources.
The point of trying to connect the actual patient to food just seemed like a no-brainer. What we're seeing is a way to directly impact not only with medicines, but here's actual access to food too. I think we're onto something as far as that holistic look at how we help a patient.
This is a way for medical providers to continue to provide high quality medical care, but start to bring in the ability to start to address some of the other things that are really impacting folks' health.
It seems that these partnerships, obviously starting local, like we are here with the UVM Med Center, are ways to actually build something more sustaining.
Feeding Chittenden and Hunger Free Vermont they're really the experts in this. We're not here to solve the problem on our own, but to partner with people who are doing this work and have been doing this work for a long time.
One of the things that I'm really passionate about is just helping people to understand that I've been the face of food insecurity. So by us kind of owning that and being able to talk about it openly as professionals, it's really engaged our team in being more consistent in asking the question and in asking it in a way that will actually get the information that we need.